I think the other thing that ends up being an investment is in the patient having an expectation that this is the way medical care is delivered.
Yes.
Ultimately we want a patient to go to a practice and say, oh, you don't have a behavioral health clinician? You don't have a team that can surround me? I may need to shop elsewhere. And actually putting the patient in the driver's seat as an advocate for the kinds of things that make that visit meaningful and have the biggest impact, I think, on whatever they're doing, their health in particular.
Great points. Any final thoughts?
I think one of the other things that I just want to mention is while somebody in a private practice or in a different system that doesn't necessarily have the reimbursable capacity, for instance, that an FQHC does, they may even start thinking about using people that we are referring to as community health workers or patient navigators. And so these are generally people with some very modest training, but who can make a huge impact in linking patients and linking people to community resources and doing a certain amount of outreach on behalf of the clinician as well as on behalf of the patient, and creating those partnerships. And that may be a very cursory first step for someone who's in a different system that perhaps doesn't necessarily enable them to have some of the flexibility that we have here.